Hi, Marina. Thank you so much for having me.
We are so pleased to be presenting this session today in partnership with CMHA. So I think we can go ahead and get things started.
Fantastic. Well, thank you very much. And hello, all 861, 862 of you beautiful folks all across Canada that are here today, primarily because you're interested in this topic. And what that means is that you're interested in creating a workplace that supports the psychological health and well-being of everybody that's working there. So I'm really excited to be here. What I can tell you from my experience with the Canadian Mental Health Association is that this topic, psychological health and safety, workplace mental health, workplace well-being, whatever name you want to give it, is becoming increasingly relevant. And this is true in both the private sector, the public sector, and then also, of course, the nonprofit sector, where we are continuously asked to do more with less. And so this really, I think at its core, comes down to an issue of culture. And the culture of nonprofits is I would say, variable across Canada, but it is sort of this underlying theme of high workload, high pressure that is ultimately driven by our mission. So what I'm hoping to do today is to talk about psychological health and safety and shift that conversation to say, how does building a healthy workplace actually align with the mission of many nonprofits? And then, of course, how do you start doing that? So a little bit first, I suppose, about the Canadian Mental Health Association. There we go. So the Canadian Mental Health Association, there it is, just popped up on your screen, is 100 years old, which I think is quite cool. We've been around as long as some of the oldest institutions in Canada, and we've been serving Canadians from coast to coast to coast for over a century now. We have 330 locations across Canada, 5,000 staff, and we serve well more than 1.3 million Canadians every year. So we've got a wide range of supports that are primarily community-based, but also settings-based. And workplaces as a setting is one area where we have had some pretty intentional focus now for the last 15 or so years. So we've been doing this for quite a while. And I think that our broad scope gives us the lens to say, what are Canadian workplaces looking for? What are the needs across Canada and across many different sectors as well? In addition to learning a little bit about CMHA, I think it's also fair that we find out a little bit more about me. And just to give you some context, this should pop up on your screen quite shortly. My apologies. Looks like we're having a little bit of lag. There we go. This is me. My name's Jordan. And as Marina mentioned, I'm the National Director of Workplace Mental Health Services. So I have a bird's eye view of everything CMHA is doing to support healthy workplaces across Canada. What's also interesting to know is that I have actually spent my entire career in the nonprofit sector. Now, you'll look at that picture of me and you'll say, well, Jordan, your entire career is probably about 3 months because you look 12. And I'm happy to own that. But a little bit more about me, I suppose I'm a registered occupational therapist. I have a master's degree in occupational therapy from the University of Manitoba. My clinical experience is very frontline service delivery. So in case management, in rehabilitation, and also in crisis services. I have leadership experience at the local level and now as well as the national level. I led one of our small rural CMHA branches in Manitoba for a number of years. And so I certainly understand the nonprofit mentality of rolling up your sleeves to get things done. In my role there, I was the finance person, I was the human resources person, I was a landlord fixing air conditioners, and everything in between. So, I understand, at least to some degree, the pressures that nonprofits face with respect to capacity and workload. And all of that sort of helps me frame, I think, the context of this discussion around psychological health and safety with a little bit more color and flavor, perhaps. And then at the national level, of course, I've experienced engaging with corporations from across Canada. CMHA, through our national office, regularly engages over 400 organizations that are taking active steps to build a mentally healthier workplace. And that's across all sectors, from public, private, nonprofit, all industries, and all sizes as well. So the smallest client we work with is 3 people. The largest client we're currently working with is about 40,000 people. So I've certainly got the understanding, you know, from big to small and then across sectors to hopefully provide some insight into what does in fact make healthy workplaces. So let's get into it then. Here's what we're going to do today. It's a couple things. We're going to answer a few key questions. So the first one, of course, what is psychological health and safety? Second is, why should I be addressing this, or why should you be addressing this? Specifically as a nonprofit organization, why should you be addressing this? What are the reasons to actually pay attention to this as an issue? How can I get started? What are the concrete first steps to building a mentally healthy workplace? And then, of course, how can I make this a reality in my nonprofit? Because you know, we have challenges around resources and capacity, but we're incredibly driven, and I think that we can use that strength as well as take advantage of some really easy solutions, tools, and resources out there to start making this a reality. So what I want to do first is, of course, just lay out the foundation so we all have a common understanding of what we're talking about when we say mental health and psychological health. So first and foremost, you know, we know that mental illness actually affects a large percentage of Canadians. So we've got about 7.5 million Canadians, about 20% of the population, that have experience of mental illness. And this is actually a statistic that is relatively equivalent across all developed countries. So we know that this 1 in 5, 20% is pretty common, pretty consistent, and hasn't changed certainly over the past number of years. We know that mental illness in and of itself comes with a high burden, high disease burden, and it's a leading cause of disability. And in Canada in particular, it's a leading cause of disability claims if we relate this back to the workplace. So there's dollars and cents attached to the cost of mental illness and mental health problems in Canada. So CMHA also did a recent study, and this should pop up on your screen. There we go. The state of how Canadians view mental health and mental illness, and particularly mental health services in Canada. And what we found is that in the 18 to 34 range, so the cohort that's really getting into the workforce, they actually view depression and anxiety as an epidemic in our country. And you know, we have 1 in 5 on an annual basis that are going to experience a mental health problem or illness, but actually by the time people reach age 40, chances are about half of the population is going to have this experience. So 1 in 5 is actually an annual statistic, 1 in 2 by the time you're 40. And so this is significant. The other thing that we know is that 85% of Canadians report unmet needs related to mental health services or supports. And this is significant because ultimately it means that for the working population, in a lot of cases, it's the workplace that's picking up the tab for those unmet needs. The primary example would be utilization of psychological benefits. It's a great way to illustrate it. So Canadians don't have their health needs met with respect to mental health services. And so we actually see them using services that are provided by employers to meet those needs. So in a sense, our healthcare system has unintentionally shifted some of this burden onto corporate Canada and as well as nonprofits to pick up some of the slack in terms of the services that we're able to provide. So there's serious dollars and cents associated with mental illness. And there's also, conversely, serious potential for return on investment by creating a workplace where your employees are, in fact, psychologically healthy. So the bottom line is that mental illness in Canada costs us about $50 billion per year. And so this includes the cost of providing healthcare services, as well as the costs of what people refer to as lost productivity. So whether it be absenteeism, sick leave, presenteeism, although that's a little bit harder to quantify, but essentially 20 billion of that 50 comes straight out of workplaces as lost productivity. So it's significant. If we bring that down to a more minute level, or at least a more personal level, what we know is that 500,000 Canadians are going to miss work this week due to a mental health problem. And you know, if we think of those 500,000 Canadians, for example, maybe they're missing work and they're calling in sick. Well, actually, there's a statistic out of the UK, and again, if we sort of consider first world countries as relatively equal, 95% of people who call in sick to work for a mental health issue actually tell their employer that it's something else. So they're not at work because of a mental health problem, but they're actually telling their employer that it's something else. So the costs are significant, and perhaps even more than we as employers might realize. 2/3 of Canadians on average would not tell their employer if they were experiencing a mental health problem or illness. And this statistic really shocked me. It's from some recent census data that says 47% of working adults in Canada say that work is the most stressful part of their day. Now that, I think, carries a tremendous amount of weight, because through a huge body of medical literature, we know that chronic stress is linked to poor health. Stress brings about many, many health problems, both physical health problems as well as psychological health problems. And it all comes back to that extra level of cortisol in the brain. So workplaces, whether we like it or not, are being impacted by mental health problems. And in some ways, we can say that workplaces are actually contributing to mental health problems when they're not as healthy as they could or should be. So we've talked about mental illness and mental health problems, but the other thing I want to reinforce here is that we actually all have mental health, and 5 in 5 of us have mental health is the way we like to explain it at CMHA. 1 in 5 of us is going to have an illness this year, but all of us have mental health as a resource that we need to take care of. And so I would say that how this is, and sorry, if I break that down a little bit, mental health very concretely is, you know, for some people a kind of an abstract concept to wrap our head around, but you know, I always explain to people that it consists of 5 things. It's confidence in your own ability to get things done, contribution to something that is more than just yourself, connection, meaning real, meaningful relationships to those around you, enjoyment, meaning enjoying most of what you're doing most of the time, and we know that's not going to be 100% at work. And then finally, resilience, the ability to bounce back when obstacles get in your way. So that defines mental health essentially. And we want to encourage all Canadians to look after their mental health. And so that ties in very well with what we're going to talk about today with respect to psychological health and safety, because there's both a preventive and a promotive aspect to what we want to do in workplaces. So in the past, you know, we've talked about sick workplaces. And that has often referred to, you know, sick building syndrome, right? When the air quality is poor, when there's respiration issues, when there's a bug going around. But you know, I think we really need to reframe this and actually say that the sickness in workplaces, you know, is primarily psychological in nature. But I want to contrast that with saying, you know, what if work was actually a place of refuge? And wouldn't that be great? You know, I think everyone wants to work in a place where if things are going bad in other areas of life, they can come to work and they can feel supported. They're there 8 hours a day, roughly. All of us are. And if you're working in the nonprofit sector, I'd say it's maybe more like 10. But wouldn't it be great if our workplace was actually the place where we could go to feel supported and safe, and to have an opportunity to look after our mental health there, because we're there so often. And that's really what we're striving for, is to make workplaces a place of refuge when other areas of life are negatively impacting our mental health. And so today I want to talk to you about a step-by-step process that can be used to sort of heal your workplace psychologically speaking. And it's called the National Standard of Canada for Psychological Health and Safety. I'm going to tell you what it is and how you can start implementing it in your workplace. But I want to just be clear, though, that what we're talking about today is not a one and done. You don't get to having a healthy workplace and then just leave it. It involves a continuous commitment to revisit these steps that I'm going to talk about today on a regular basis. So that's just a disclaimer that I want to put out there, is to say that the mission of building a mentally healthy workplace is not a one-time task. It's not a time-limited project. It's actually about changing the way you do business and changing the practices, processes, and policies within your workplace such that it makes it easier for everyone to be their healthiest. So then let's talk about the National Standard of Canada. So this was a standard developed in 2013. It's a CSA standard. It was developed jointly by the CSA and the Mental Health Commission of Canada. And it has a dual purpose. So like I've said, the purpose of the standard is to prevent psychological harm and promote psychological health. And for this purpose, we could say psychological health, mental health are synonymous in this case. So it's with that dual purpose that the standard exists. So preventing psychological harm, of course, these are things really obviously like bullying and disrespect and incivility. Promoting psychological health is those 5 things that I talked about before: confidence, connection, contribution, enjoyment, and resilience. So the standard is really an approach for the 1 in 5 and the 5 in 5. So it's about creating a workplace where if you're experiencing a mental health problem, you have the support you need. And if you're not experiencing a mental health problem, you have the resources and the environment that's gonna enable you to look after your mental health and well-being. So the standard really specifies a process rather than an end state. And that's something that I want to be clear about at the very front end. So the standard is essentially a continuous quality improvement process. This 90-page document, and basically it outlines a plan, do, check, act type of process where you need to examine the state of your workplace, you need to make appropriate changes to improve psychological health and reduce risk, and then evaluate whether or not those changes had any impact. So because it's a process and it doesn't describe a specific end state other than your workplace is psychologically healthier, the standard is actually fully adaptable to an organization of any size. Big, small, for-profit, or not. And so when the Mental Health Commission of Canada and the CSA released the standard, they did a 3-year study on pilot organizations that were going to implement it. And again, those organizations ranged from small to large across all sectors. And what they found was that the standard was applicable to all of them because it's process-oriented rather than end state oriented. Other standards, like standards that govern the bridges we drive on, say that it has to meet a minimum load requirement, and if it doesn't, it's no good, can't pass. But this standard for psychological health and safety is about a process to say that you need to do X, Y, Z in this order cyclically, and here are the checks and balances you need to have in place, but it's not going to say you need to have an EAP program. It's not going to say you need to provide training for your staff, although those are all really good things to do. it's going to tell you the process you need to plan, do, check, and act. So that's what we want to talk about in terms of those steps. What are they? So in terms of key steps for implementing the standard, I'm going to talk about 4 today. One is ask yourself why. So what's the rationale for implementing the standard? What's the rationale for addressing psychological health and safety, particularly as a nonprofit? Step 2 is to do an assessment. So take stock of what you're already doing, as well as risk factors in your workplace. Step 3 is to dig in, and by that I mean build on what you're already doing and hopefully what you're already doing well. And then step 4 is about building on it. So what else can you do that's hopefully low cost or no cost that's going to improve the state of psychological health and safety above and beyond what you are in fact already doing, and you're all already doing something. So let's start with the why question. And generally speaking, there are 3 reasons why any organization would implement the standard. It's for financial reasons, for legal reasons, or for ethical reasons. And so in that case study, they actually asked organizations why in that research project that they did. And primarily, organizations said that they wanted to implement the standard because it was simply the right thing to do. And this is interesting because these were nonprofits and for-profits. And so I wanted to highlight this because actually, for-profits are in this from an ethical standpoint as well. And so I think that, for us in the nonprofit world, this should be so easy for us to get behind in terms of being mission-driven organizations. So other reasons, of course, to protect health and safety, to increase engagement, enhance reputation, manage costs, and reduce liability. So what I want to do is I want to break down a couple of ways that you can sort of justify or support improving psychological health and safety from a nonprofit perspective. And so the first one I want to say is, is this concept of a healthy workplace explicit or even implicit in your mission? For many of us, it is. The Canadian Mental Health Association has, for us, it's easy. Our mission is mental health for all. And that's pretty easy to say that, okay, well, then that obviously means we should be looking after our own workforce. But your mission might have a similar explicit or implicit connotation to say that actually looking after our people makes really good sense based on what our mission is. So if you value things like collaboration, connection, quality services, then you can see or start to see how improving psychological health and safety actually aligns with what your organization is already trying to do, just perhaps a focus internally versus externally. And if you can align psych health and safety with your mission, vision, and values, it's going to be much easier to get buy-in from all levels of your organization, including, for example, your board of directors, to say that, yes, we need to dedicate time, energy, and resources to doing this. Another reason is that psychological health and safety is sort of implied in actually 7 different branches of law. And this is something that's articulated by Shane, who's a legal expert in this area. And although addressing psych health and safety and implementing the standard is not mandatory at this point, it's a voluntary standard. Shane makes the argument that actually, if you look even just a few years down the road, there's going to be increasing legal precedent to say that as an employer, you should in fact be providing a work environment that does everything it can to protect the psychological health of employees. So there is, while not a current legal impetus, there is certainly a building legal impetus to consider this. Now, of course, as a nonprofit, everyone's watching your bottom line. And your board, your funders, your executive director, if that's you, everyone's watching expenses. So what we know is that initiatives to enhance mental health in the workplace, this is based on a study in the UK, have anywhere from a 200 to 400% return on investment. So that's a 2 to 4x return on investment. So that's pretty significant. So if you're looking at ways to sort of manage costs, building a healthier workplace can help you do that. Not only is it going to cut costs on things like benefits and absenteeism, it's also going to have a return on investment for anything you do to promote health. So that's something that you can be quite confident in. Of course, this is a way to take care of ourselves, our volunteers, and our teams. And this should pop up shortly. So of course, again, this makes really logical sense, especially in terms of keeping volunteers. I know that volunteers are the lifeblood of many of our organizations. And so building a healthy workplace, again, is not just for our workers, but it's for anyone that enters our workplace. So volunteers in particular, but even clients as well. The quality of service you're able to provide clients is going to be better if you have a workplace that is, in fact, a psychologically safe and healthy environment that they're entering into. This is also a signpost for your ethics. So if you're looking for things to sort of highlight to your donors, to your funders, etc., having initiatives in place to build a healthy workplace could actually be seen as really quite valuable and a sign of trustworthiness as a nonprofit or as a charity. Other ways that psychological health and safety can be beneficial for your organization, it would be in terms of preventing burnout, retaining your team, enhancing creativity and innovation within your teams. And then it's also part of your appeal as nonprofits are fighting the private sector for a share of our workforce. Having a work environment that is healthy and safe and supports psychological well-being can be a huge selling factor. And I'm speaking as a millennial who's working in a nonprofit, and it's part of the appeal for me. So I think that those are some additional reasons. And then finally, the last reason I would say that sort of brings psychological health and safety into the nonprofit space and really cements and justifies its purpose there is because ultimately this is our life. We take work with us outside of the workplace, and it bleeds over into every other aspect of our life. And so if nothing else, addressing psychological health and well-being within the workplace is essential because we want healthy employees going home and building into healthy families and healthy communities, and ultimately a healthier society. So I think that's probably the biggest high-level reason why this makes sense. And so I highlight these not because you need convincing, you're already here learning about it, but because other people in your organization might need convincing that this is something worth doing. And what we know from evidence is that the one thing that helps sustain initiatives to improve psychological health and well-being is leadership buy-in. If you have leadership buy-in and it's consistent, your chances of success are higher. If you don't have that leadership buy-in, it's an essential part of the standard. But more than that, it's more likely that any initiative you undertake to improve psychological health and safety is ultimately going to fail or fall flat. So getting that leadership buy-in from the start is absolutely essential and critical. So once you've done that, once you've convinced yourself, you've convinced your teams, you've convinced your leaders that addressing mental health in the workplace is the right thing to do for many reasons. What's next? And the next step is really taking stock. And this involves an assessment of your organization. Again, this is part of what's articulated in the standard, is to say you need to actually take a look at your organization and identify a number of things. Identify what you're already doing to protect employees and to promote their health, what risk factors you might not be addressing, and most importantly, what strengths you have, what things you already have that you're doing that you could build on. So this assessment phase is really important. So where we suggest you start is by reviewing and even updating what you already have in place. So you need to know what you have before you can improve on it. And so I want to run you through a couple sort of top line questions that you can ask yourself or your organization can consider during that current state assessment. And so the first one is from a policy perspective. Are there policies or processes that we can build on that are already supporting psychological health and well-being in our workplace? So common policies or processes that we see in workplaces that actually support good psychological health are accommodation, and specifically considering it from the lens of mental health issues. Do you have a policy statement on health and wellness? And if so, does that incorporate an element of psychological wellness or mental health? Do you have bullying and harassment policies? Chances are you do. Are they up to date? Are they inclusive of all forms of bullying or harassment that you want to be aware of in your workplace? Second question, in terms of what you have and where you can get started, is can you enhance the mandates of any existing committees? Do you have a health and well-being committee? Do you have a joint health and safety committee that could actually expand their focus to say, actually, we want to look at psychological health as well? And then also, do you have previous experience implementing other standards? For a lot of organizations that have well-defined health and safety risk management systems, a psychological health and safety risk management system is actually not all that different. And it may actually just be a matter of incorporating some elements related to psychological risk in your existing health and safety management system. Third question you should ask yourself is, do you have any data to assess your current state and your progress? And so the standard does in fact say that you should have some form of data to quantify metrics within your organization that relate to psychological health and well-being. So common data points that people use are, say, absenteeism or sick time, employee assistance program usage, turnover are some of the main ones. So do you have that data within your workplace? If so, great. That's really valuable, and that can actually serve as a reference point, a year, 2 years, 3 years down the road, to objectively say, have we made a difference? Because we know that if we improve psychological health and safety, we're going to see improvements on those numbers as well. Another question you could ask is, do you have a training or leadership program where a mental health module, for example, might fit? Many of us have internal leadership development programs or training programs. As a simple win, could you actually incorporate some learning around mental health and mental health issues, how to support employees who are experiencing mental health issues, even how to look after ourselves and manage stress effectively? Can you incorporate them into existing training programs? I think is a really easy way to start bringing this subject to the leaders in our organizations as well. You can look at your employee benefits too. Could you maximize them or perhaps even enhance them? So a classic example is, of course, Starbucks, right? Starbucks increased their psychological benefits for all employees to $5,000 a year. Manulife did the same thing, except they went to $10,000. And actually what they saw, Manulife in particular, was a return on that investment in about 2 to 3 years. So they actually quantified it. So as a starting place, what do your benefits look like? Are there areas where your employees perhaps could use additional support that they aren't getting right now? And then finally, do you have any obvious champions or team members who have relevant knowledge or interests? Maybe this is something that they would want to be involved in. And we know that aside from leadership buy-in, having champions on the ground throughout the workforce is essential to driving initiatives aimed at supporting a mentally healthier workplace. So when you're taking stock, be really intentional about identifying if you have people that are already interested or committed to this cause. And if so, maybe there are people that you could tap into to be involved or even lead what your organization could do to improve psychological health and well-being. So the other thing I want to talk about in terms of taking stock is a little bit more technical, and this involves assessing psychological risk in your workplace. So you want to take stock of all of the resources you have, areas that you could be improving, policies that are supporting mental health and well-being and psychological safety. But you also want to assess specific risk factors. And so in the standard, there are actually 13 evidence-based risk factors that are impacting not just your work environment, but any work environment. Coincidentally, the standard actually names 14. The 14 is sort of a catch-all for anything else that your employees say is impacting your psychological health and safety. But there are 13, generally speaking, that apply across every organization. And these are things that you're probably already thinking about and talking about, but maybe haven't quantified. So I've got them up on the screen, and there's a whole lot of literature that you can read around these particular psychosocial risk factors. But it's everything from stuff that we commonly talk about, like civility and respect, protection of physical safety, but then also things like workload management, recognition and reward, involvement in organizational decisions, how well our psychological skill set and competencies actually match up to the job that we're doing. And these are all identified risk factors. And what I mean by that is that if they are not present, the chance of psychological harm is greater. And of course, if they are present to a high degree, they actually do a lot to support our psychological health. So for example, if you're in an organization where you feel like you can grow and develop and you're supported to do that, chances are you're going to feel more confident in your skill set, you're going to feel more connected to your work, and you're probably going to enjoy it as well. So these 13 factors, like I said, are both risk factors on one end, but also promote psychological health and well-being on the other end. So how do you assess them? And that's the big question. And I want to point you to a free tool. And I'm always a fan of free. Sometimes free means low quality, but in this case, if you're looking for a tool to assess psychological health and safety in your workplace, I would highly recommend, without reservation, a tool called Guarding Minds at Work. Guarding Minds at Work, if you've heard about it, fantastic. If not, I'll give you a quick overview. But it's evidence-based. So it's developed by the same researchers who identified those 13 risk factors. It's easy to use. It's roughly a 60-item employee survey that's pretty quick and easy to set up and distribute. And of course, it's action-oriented. So it gives you a risk profile that aligns with each of those 13 factors, then also recommends actions that you can take in your workplace to address them. Which I think is really friendly and helpful, and actually gets you pointed in the right direction really quickly. So if you're looking for a way to assess those 13 psychosocial risk factors, Guarding Minds at Work is my hands-down recommendation, and it's totally free. And someone just popped the link into the chat, which is fantastic, so thank you for that. So once you've done your current state, you've done an assessment, what can you do? So once you've taken stock, it's time to put together that action plan. And some of your assessment is going to lead into that. Some of what you're currently doing and where you have strength is going to build onto that as well. But what I'm going to do is I'm going to highlight some of the top actions that other organizations have taken to address psychological health and safety that apply really well to a nonprofit workplace. Any workplace in general, but specifically to a nonprofit setting. And I think you'll find that the most common actions organizations take are really not that difficult and actually not that resource intensive. So hands down, the most common thing organizations do to address psychological health and safety as a really great starting point centers around the issue of respect. So we know that there are already requirements for a respectful and civil workplace. And the main thing that most employers do first is they actually review these policies, ensure they're up to date, and most importantly, ensure that you're communicating them to your employees, reinforcing them, and that they're being understood and followed. So this is, I think, a really straightforward action that has a direct benefit and impact on that civility and respect risk factor. And it's something that you're likely already doing, but maybe you could do it better. So that's the first thing that I would suggest is take a look at your respectful workplace policy, make sure it's up to date, make sure it's being communicated to all of your employees, and more importantly, make sure that people are following it. The second thing that many organizations do that I would say is a really great place to start is looking at your benefits. And there's a lot of emerging evidence around the benefits of benefits. If we think about Maslow's hierarchy of needs, for those of you that are psychology majors or psychology professionals, we know that having some of those basic needs met is really ultimately good for overall health and well-being. And so things like having better coverage for prescription drugs, having increased access to EAP, having increased access to go see a psychologist or to take your, or even more, to take your family member to see a psychologist is going to provide a sense of safety and security for your employees. So a lot of organizations end up making changes to their benefits to include additional services or enhance the services that are already there, and of course, communicate about it. Organizations that address psychological health and safety often see a rise initially in their EAP usage, which is exactly what we want to see. It means that employees know that support is available and they're reaching out for that support, which is an excellent thing because something like EAP is a cheap service from a cost analysis. It's also typically a preventative service or an upstream service, and that people can access EAP before they're maybe ill to the point where they can't work. So you want to encourage your employees to use it. The third thing that a lot of employers do is they train staff to intervene. So they train their teams, their managers, how to respond to psychological health or safety issues. Commonly, people look to something like mental health first aid. But that being said, there are a lot of other solutions out there as well to provide some basic training to your management team about what is in fact a psychological risk in the workplace and how to respond when someone is showing signs of poor mental health at work. Now, the one disclaimer I'll have here is that quite often people jump to training as a first step, and I actually discourage that. If you haven't actually done an assessment of what the current state of your organization is, or what your particular training needs are, you can spend a lot of time and money on training that really isn't hitting what your needs are, or for that matter, what your psychological risk factors are. So training should always be done after a really fulsome assessment rather than as a first step. Number 4 is awareness. So providing employees with knowledge and understanding about mental health and about stigma and about mental illness helps create a culture where it's okay to talk about this kind of stuff. So CMHA's Mental Health Week is a great example. Many organizations use it as a platform internally to create dialogue about mental health. Our Not Myself Today campaign is another great example of an initiative that many employers are using, over 500 across Canada, to socialize a culture where it's okay not to be okay, and it's okay to talk about it when you're not feeling okay. So awareness is number 4. Number 5, again, is training, but not necessarily training to intervene, training to develop your own personal skills. So when we talk about mental health in the workplace, there's 3 contributing factors, basically. The first one is the work environment, which is sort of where we're focused today. The second is everything outside of work, so your personal and life circumstances that we take into the workplace with us. And then third is our own personal skills to deal with both of the above. So providing your teams with the opportunity to learn skills to better manage stress and to better take care of their own psychological health and well-being is also a very common action that does go a long way. But again, with the understanding that it's really only a small piece of the picture, that the work environment has a huge impact on how effectively we can actually use those skills. 6 is accommodation and return to work. So again, this lines up sort of with that civility and respect, and that you probably already have policies around accommodation. Are they as inclusive as they could be about mental health issues or mental illness? So how do you actually support employees to stay at work when they're ill, as opposed to leaving the workplace? Because we know that once you leave the workplace, especially with mental health conditions, it's a lot harder to come back. And then of course, return to work, right? So do you have appropriate processes in place to help people return to work? Specifically when it's a psychological injury as opposed to a physical injury. We're really good at accommodating and returning people to work with physical health conditions and injuries. We are admittedly not so great at doing it with psychological health conditions and injuries. A great tool that that maybe we can send out a link as well is it's called Supporting Employee Success. It's available through the Great West Life Center for Mental Health in the Workplace. And it actually provides some ideas about how you can explore an accommodation process for an employee who's experiencing a mental health condition at work. It certainly has my full endorsement. It's a great tool. I show it to many employers all the time. And then finally, of course, track your progress. A lot of employers miss doing this, right? They maybe don't do that assessment at the front end, but more than that, they don't evaluate after the fact, right? So part of our continuous quality improvement cycle, plan, do, check, act, says that you make a plan, you do it, but then you come back and you say, did it work? So that's why it's important to take stock of some of those basic metrics at the beginning, is so that you can go back after you've taken some actions and say, has it objectively improved things? If it has, great. Keep building on it. Find out what you can do next. If it hasn't, maybe you need to go back to that original assessment to say, did we get it wrong? Did we identify the wrong needs? Or maybe, did we simply choose the wrong thing to do, and that solution wasn't the most appropriate for our workplace? And then finally is use free resources. So, as I can speak from a nonprofit perspective, there are a lot of really expensive solutions to address psychological health and safety. Benefits providers have them, private consultants have them, other companies can provide them, but there are so many free resources available to help you get started. One that I want to highlight is our takeaways toolkit, where some of this content comes from today. It's a toolkit that we developed with the Mental Health Commission of Canada, and it has really easy things like checklists and also lists of resources, whether it be training, education, information, many of them low cost to no cost, that you can look at to say, well, does this make sense for our organization? I'll also highlight again that the Great West Life Center for Workplace Mental Health, and that is full of information that is, again, completely free to use. They don't make a dime off of it, and it's incredibly high quality. They consult experts all across Canada and all around the world to develop it, and they keep it up to date with best practices. So I would also highlight that, again, as another free set of resources that you have access to. And then also keeping in mind that, in some of these common actions, a lot of it is stuff that you can do in your organization at really no additional cost. Looking at your accommodation return to work policy, addressing your civility and respect policy in your workplace, even simply encouraging your employees to start using EAP. All of these things can have a dramatic benefit on some of those identified risk factors and help improve the state of psychological health and well-being in your workplace. So with that, we've got about 8 minutes left. So I would love to have some questions from anyone in the audience, and I'll turn it over to Marina to maybe field some of those.
Fabulous. Thank you, Jordan. This has been so incredible. And we've got lots of questions coming in, but I do want to remind folks, we'll do our best to round up all of those free resources that Jordan's been talking about in the follow-up email that we send out tomorrow. So watch for that. And of course, the recording will be there as well. So you'll be able to listen back for anything that Jordan's mentioned that you can go ahead and take a quick Google search for as well. So let's jump right in. Jordan, as we're talking about resources, two questions have come up. One regarding the online self-care resources that you mentioned, and the other about the leadership modules for training. Do you have any suggestions for where people could go to find resources on those two particular items?
Yeah, absolutely. And we can share this out in that follow-up email. But both of those, actually, you can find a lot of great content on workplace strategies for mental health. It's the Great West Life Center for Mental Health in the Workplace. They actually have a program called Working Through It. It's a series of videos and worksheets online that are meant for employees who might be struggling with mental health issues. Help them understand what they can do to take care of themselves, what they can do to actually approach their employer to have productive discussions about how their mental health is being impacted. And in terms of leadership modules, I think the one that comes to mind off the top of my head in terms of management training, it's an app that was just recently released. It's called Include Me. And it's a training app for managers that walks them through a bunch of different scenarios that they might encounter in the workplace and how they could more appropriately respond. So those are a couple of recommendations, and I'll make sure that we get the links out to everyone so that they can check them out after the fact.
Perfect. And we've had a few folks asking if you could just review the 5 key things that define mental health.
Absolutely, yes. And so a little bit of context, these actually come from, or they're based off of some work from a psychologist, Corey Keyes, in the United States, and one of the early founders of the positive psychology movement. And the way I define them, and I think it's probably most accessible, is confidence. So mental health, an aspect of mental health is being confident in your own abilities to do the things that you need to do. Contribution, so the ability to give back and to find purpose in something more than yourself, and that might be your family, that might be your work, but a sense that you're contributing to something is again a sign of good mental health and is good for our mental health. Think of it like purpose, really. Connection, so meaningful relationships. We know that having meaningful, supportive relationships is really good for our mental health. Enjoyment is the 4th one. So a sign that you're mentally healthy is that you enjoy aspects of life. A sign that you are perhaps less healthy is that you actually don't enjoy as many aspects of your life maybe as you used to. And then finally, resilience. So the ability to bounce back when life throws you a curveball. And that's the 5th sort of key ingredient to mental health. And ideally, we want our workplaces to cultivate those aspects in all of us. So think about, where do you find confidence at work? Where do you find contribution, connection, enjoyment, and does your work effectively support you when curveballs come your way and you need to bounce back?
That's great. And perhaps, Jordan, do you have like a maybe even just one sort of specific example of something that you've seen incorporated at a nonprofit or maybe even at CMHA that has been helpful in this regard that others might be able to sort of take away and think about for their organization?
Yeah, I mean, aside from the ones that I mentioned, which I have seen in nonprofits, and they are fairly straightforward. The other thing that I think nonprofits do quite well and does have an impact is the issue of flexibility. So while our competitive advantage may not be salary, I think that flexibility in a nonprofit workplace can be a really significant competitive advantage. It also allows employees, from a risk perspective, it allows some involvement and influence or control over the work that they do, as well as helps them effectively manage their own workloads. So we talk about arrangements to work at home, to work remotely, or even just flexibility in terms of when you can come into the office and leave, can all be really helpful and fundamentally aren't that challenging to incorporate at a lot of nonprofits.
Yeah, that's a great example. And that actually feeds into another question that we had that I thought was quite interesting, because Jordan and I had been talking about remote-based working prior to this webinar. And we have had some questions about how these, the standard and these tips apply to someone who might be working remotely and not in the office every day.
Oh, that is a great question, and certainly not the first time I've had that question asked. So again, I work remotely. I'm actually from Manitoba. Please don't hold that against me.
We have another Manitoban on the line,
good.
Jordan, who was so excited to hear you say you were from Manitoba.
Oh, perfect. Excellent. And most of my colleagues are actually in Toronto, so I'm one of the few that work remotely. And I will say that's a little bit different, right? And some of the things that we would normally associate with building culture in a workplace, like potlucks and someone bringing candy to the office, that kind of thing, right there. You don't get that as a remote worker. But there are other things that you can intentionally shift your focus to, as a remote worker, that have a really similar impact. So I have one colleague who's actually really great about actually calling me on the phone rather than emailing me, and actually spending some time building a connection that's not just text on the screen. As well, appreciation looks a little bit different, right? Instead of a cupcake on my desk, maybe I'll get a congratulatory email, or actually even one time I had someone get skip the dishes to send me a bunch of donuts as well. So I mean, there are ways you can do it. There are ways you can build a culture that is remote that still addresses all of these factors. I think the key is just changing the way you communicate, and remembering that just because you're remote doesn't mean you don't need that human-to-human interaction. So find it, whether it's over the phone, whether it's over Skype, or whether it's taking that opportunity on a regular basis to actually be face-to-face. There is very little substitute for it.
Yeah, that's great. I can remember having a manager that just randomly would send chocolate in the mail, and that was amazing.
I want a manager like that.
Right? I know. I think we all do. Yeah. This is great. So I think we're going to cap it off here, Jordan, just because we are running up on time. I want to thank you so much. This has been such a valuable presentation. I'm heartened at how many folks showed interest in this presentation today, because it is such an important topic that we need to be proactive on. So thank you, Jordan, for bringing all of this to us today.
Thank you very much for having me.
I just want to remind everyone that we are going to follow up tomorrow with an email with the recording, the slide deck. We're going to do our best to round up all of those resources. You can always reach out to us if you have any questions about anything that perhaps was missed or that you want to follow up on. There will be a short survey that we will ask you to participate in if you can. It takes less than 5 minutes to fill out. You'll have an opportunity there to let us know if there's other topics you'd like to see covered in a future session, including if there's other topics that maybe Jordan touched on today that you'd like to see us drill down a bit further on in the future. Next week, we've got our another free webinar coming up. We're going to be talking about the brand new 2019 Canadian Nonprofit Sector Salary and Benefits Report that we just released at Charity Village. This is going to be a really good opportunity for you to get some more information about the report. There's no purchase necessary to attend. But if you are interested in the report or want to get a bit more info about it, we'll have a link in the email we send tomorrow as well, so that you can take a look at that and also register for the webinar if you are interested. So with that, I'm going to thank all of you, Jordan as well, for joining us today, and I hope to see you again next week. Have a great rest of your day. Bye-bye.